And welcome back to AM Northwest. If the only thing standing in the way of you feeling great about your body is your tummy, well, our next guest can help you take care of that. Here to tell us about Lipolift, we welcome back from aesthetic medicine, Dr. Jerry Darm, along with one of his patients, Tamara Fitz. Nice to have you both here. Tamara, you've had a few different procedures done over at aesthetic medicine, but you had the Lipolift. And what made you decide to do that?
I recently went back into a career of real estate, and I'm kind of going through my closet, and I'm trying on all of my clothes, and the pencil skirts are very much in style now, and they're very kind of form-fitting, and I just wasn't feeling right, and I just kind of had this bulge up here, and I didn't like it, and I was like, I'm done. And I didn't want to go buy a new wardrobe or anything like that to fit it, and I was like, you know, I'm done. Let's do it.
So, Dr. Darm, what is a Lipolift, and how does it work exactly?
Well, Lipolift is a pure laser lipolysis. It's not a mechanical device. It's a laser that smoothly glides underneath the skin, melts the fat. The fat is then sucked out. You wear this tight-fitting garment for about 3 weeks, and you're done. Maybe a day of downtime.
How quickly after your procedure did you see the results?
Next day.
Really?
I would say next day. I was swollen and I was bruised and everything. I didn't even bruise up that bad, really.
And what'd your friends say?
Really, nobody really noticed that much, of course, but they did look at me and go, man, your boobs look a lot bigger. That's what I had to deal with a lot, because the waist is small.
I'm in.
Yeah, and so they're just kind of like, something's different about you. What? Oh my gosh. And I'm like, no, the 3 inches of my fat is
It's all
gone.
relative, right? Yeah, there you go.
So, Dr. Darm, when we talk about...
That's actually true. There are a number of patients who come in whose tummies, stick out, further than the breasts, and so it's an added benefit that I hadn't really thought about.
Who does Lipolift work for?
Anybody that, if you can pinch fat, we can only take fat between the muscle and the skin. So if you push your finger in and you can feel fat that's above the muscle, then that can be taken, basically.
So fat below the muscle.
No, that has to be weight. That's weight loss.
That's weight loss.
That has to be taken with weight loss.
And how long do the effects last? Does the fat come back?
Well, technically, since you're taking out all the fat cells, we have not seen recurrence of fat in those areas that we've treated.
Does the weight come back in other areas?
Yeah, but it's only, surprisingly, it's only a pound or 2 of fat that you're actually taking. And so, and it spreads out, elsewhere. So really, you don't see it. I mean, and honestly, you can look 10 or 20 pounds lighter with only taking a pound or 2 of fat out.
If someone is obese, can you do the same procedure?
Yeah, we can. We might have to do it a couple of times in one area, for example, but we can still do it in
as long as it's subcutaneous.
As long as it's subcutaneous.
Yeah.
As long as it's not under the muscle.
So for you, how long before you felt like, you mentioned you had to wear a wrap of some sort for a while, how long before you just resumed a normal life and the pencil skirts were fitting and everything felt great again?
I would probably until I was up in 2 days, a day or two. You kind of actually, when it was done, I walked out and I went and had lunch with my friend. I didn't feel anything, and then probably at 10 o'clock at night, that's after the pain meds and everything, where I was like, oh man. But then probably about a day or two, you just kind of feel like maybe you got kicked by a horse, then the next day you feel like you got kicked by Rocky, and then the next day it's just, maybe you got punched by a toddler, and it kind of...
So slowly your opponents got smaller.
Yes, that's how I described it to everyone. I was like, first it's a horse, and then Rocky. And,
People do leave with pain medicines, right?
Oh, absolutely.
Yeah, okay.
But you're wide awake during the procedure, actually.
Oh, you are? Okay.
Yeah, you are. You take a little bit of a Valium-like drug and a little bit of pain meds beforehand, but really not that painful during
You don't feel anything. I'm talking to the doctor, like, oh, how are the kids? You're like laying there and they're doing the procedure and you're just having a conversation with them.
Well,
like,
and you look great.
Looks great.
Yeah,
so well worth the kick from Rocky.
Yeah,
indeed. Well, folks, so if you'd like more information about aesthetic medicine, give them a call, 503-697-9777, and we'll have information, too, on our website at katu.com. Thanks for sharing the story.
Thank you.
Thank you.
All of the story.